Good morning, I'm Rachel Justine Catarque, a student nurse from the University of Batangas, and I'll be demonstrating perineal flushing and perineal care. So first is I will gather the materials needed. So I have my bedpan, my underpad, my 7 dried cotton balls, 7 cotton balls soaked in betadine, my kidney basin, with lukewarm water, my forceps, my towel, and my gloves. So after gathering the materials needed, next is I will perform proper hand washing and wear my gloves. So after wearing my gloves, I will explain the procedure to the patient. So good morning, ma'am. I'm Nurse Rachel. Today I will be performing perineal care, or I'll be cleaning your perineum. This is to prevent infection. May I know your full name and birth date? So okay, Ms. Smith. So to provide privacy, I have closed the door and I have closed the curtains. So after providing privacy to the patient, next is I will place the patient in dorsal recumbent position. So ma'am, I will just be placing you in a dorsal recumbent position. Can you flex your hip while I move your lower leg? So while placing the patient in dorsal recumbent position, I will make sure that the patient is draped properly. Then next is I will place the underpads underneath the patient's buttocks. So ma'am, I will just be placing the underpads under your buttocks. So can you lift your back in the count of 3? 1, 2, 3. Then after placing the underpads underneath the patient's buttocks, next I will be placing the bedpan underneath the patient's buttocks. So next, ma'am, is I will be placing the bedpan underneath your buttocks. Can you lift your back at the count of 3? I'll be assisting you. 1, 2, 3. So after placing the bedpan underneath the patient's buttocks, next is I will put the kidney basin close to the patient, and I will get my forceps and betadine soaked in my cotton ball soaked in betadine. So ma'am, I will just be lifting your covers. So I will start cleaning. This will be a little wet. This will be wet. But before this, I will wash the patient's perineum with lukewarm water. Cotton balls. I will start from the patient's clitoris down to the patient's perineum. Then I will discard. Then for the labia minora, in a symbol of 7, then the patient's clitoris, then 7 down to the the labia minora. The other side. Then next is the labia majora, symbol of 7. The other side. Then next from the patient's groin, going outward. Then from the other side of the patient's groin, inward, going outward. Then next is I will get my dry cotton balls. And with the same pattern, from the middle, from the clitoris down to the perineum. The labia minora. So the next 7. And the labia majora. And from the patient's groin, inward, going out. Then the other side, inward. Then if the patient defecates, I will turn the patient to the side and I will clean the patient's anus. Then next after this is I will pat dry the patient's area that was cleaned using my towel. So careful not to use the same side. So after patting dry the patient's area, I will remove the patient's bedpan. So ma'am, I will just be removing your bedpan. In the count of 3, can you lift your buttocks? 1, 2, 3. Patient has any perineal stitches, I will put the prescribed medication given by the doctor to the patient's perineal stitches. And after that is I will empty my bedpan and I will remove all other materials. So ma'am, I'll just be removing the underpads. So in the count of 3, can you lift your buttocks? So 1, 2, 3. Then after removing all materials and fixing all materials, next is I will perform proper hand washing. I'll be removing my gloves. inflammations, any unusual discharge, or if it is swollen. Yeah, that's all. Thank you.